everyone. Welcome to my presentation, Maternal Age at First Birth and Child Undernutrition in Bangladesh, Evidence from Bangladesh Demographic Health Survey. In LMIC low and middle income countries, around 21 million girls become pregnant before their 19 years, and among them 12 million girls can give birth. And globally, around 150 million under 5 children are stunted, 45 million are wasted, and 47 million under 5 children are underweight. In low and middle income countries, around 45 children are dead due to malnutrition. Though Bangladesh made some progress in terms of wasting and underweight, but the average stunting rate was 10% higher compared to the other Asian countries. In Bangladesh, 66% of adolescent girls become mother at an early age, and giving birth at young age is very common in Bangladesh, and it has adverse health effect on child nutrition and health. And in this study, we examined the relationship between mother age at first birth and child undernutrition in Bangladesh. Literature also suggested that children of young mother were 8 times more likely to be stunted, 3 times more likely to be wasted, and 30 times more likely to be underweight in a study conducted in Ghana. And India, a study shows that 20% of mothers give their first birth during their adolescence period. And they also shows that the under 5 children of adolescent mother are at risk of being undernourished. For this analysis, we collected data from BDSS, and where we listed the 8,759 children for the analysis. But from this, some are dead and some are absent for weight and height measurement, and some are flag case, and some are missing information. And finally, we selected 7,643 children for our analysis. In our outcome variable, we consider the stunting, height for age below -2 standard deviation Z-score, for wasting, weight for height below -2 standard deviation Z-score, and underweight based on the WHO median growth standard. And for exposure variable, we consider mother age at first birth as the main exposure variable, and categorize the mother age at first birth below 19 years and over 19 years for adult mothers. And for independent variable, we consider the household head, mother BMI, age of children, delivery by C-section, mother's education, father education, wealth index, birth weight, antenatal care, and respondent currently working status as well. We analyze the data using a statistical software, Stata version 15, and descriptive statistics were calculated and reported with percentage and number, and multiple logistic regression were performed to see the association between mother age at first birth and undernutrition of under 5 children. And the outcome variable categorized 0 for normal and 1 for stunted, wasted, and underweight for the respective variable. And for conceptual framework, we consider the mother status, mother age at first birth, currently working status, mother education, and mother's BMI. For socioeconomic status, we consider wealth index, household head, and father's education. And pregnancy status, we consider the antenatal care visit, delivery by C-section. And for child status, we consider the birth weight, age of children, and sex of children. And finally, overall, this variable has impact on underweight, stunting, wasting, and as well as overall impact on child nutrition or not. In our analysis, we found that the around 72% mother gave the birth before their 19 years age, and mother were normal, 61 mother were normal, and mother's secondary education 50%, and father education as well as 33%, and wealth index also. In multiple logistic regression model, which is that children of mother age below 19 years were more likely to be 1.6 times more likely to be stunted compared to the adult mothers, who is over 19 years, which is statistically significant. And we found that the children of below 19 years, below 19 years mothers are also to be 1.4 times more likely to be stunted compared to the over for the adult mother, and which is also statistically significant. And children of below 19 years mothers were 1.4 times more likely to be underweight compared to the over adult mothers, which is also statistically significant. And we adjust the model: household weight, antenatal care, childbirth weight, and respondent currently working status. And we see that the mother below mother age at first birth had the impact on the child undernutrition. That's why we need to take policy initiative for to increase the awareness program for maternal age at first birth, and to working on the reduce all form of child undernutrition, and young mother required to be special consideration during their pregnancy and postnatal period, and younger maternal age between the also consider the policy practice, and also it to understand the deeper, it also need to conduct a qualitative study. Finally, thank you everyone.